prepare yourself to elevate your skills to the next level. This is a problem that unfortunately very often affects many patients and can be a real challenge for both them and health professionals. Throughout the video, we will guide you step by step, identifying trigger points and applying effective pressure to inhibit pain efficiently. Let's get started. Why treat these trigger points? True sciatica is often confused with that generated by trigger points. Obviously, in cases of sciatica generated by trigger points in the gluteus medius, minimus and piriformis, the symptoms of neuropathy are not present. Therefore, if the sciatica is due to trigger points, we do not have reflex alterations, for example, nor loss of strength, nor changes in feeling. We only have the typical pain radiation, which can be easily identified through trigger points. To locate these muscles, we first identify the iliac crest. We know this is the patient's iliac crest, and we also know that the gluteus medius originates from the iliac crest and inserts into the greater trochanter, while the gluteus minimus originates slightly lower than the gluteus medius, a bit deeper in the posterior iliac fossa. It inserts into the greater trochanter as well. Once we have identified the area between the iliac crest and the greater trochanter, we can establish our action zone. In this zone, we will have the gluteus medius and minimus. At this point, once the area is found, we can ask the patient to perform hip abduction, meaning to lift the leg. While resisting with one hand, we can palpate the contraction of the gluteus medius and minimus, because both of these muscles are abductors. At this stage, we ensure the patient is comfortable and use both fingers to locate the tense parts of these muscles. Once we find the tight area, which may correspond to the pain referred by the patient right at the moment of our palpation, we locate the tightest part that corresponds to the trigger point. Once we find the trigger point, as in this case, we ask the patient, is there radiation going down the leg? If the radiation is typical of the sciatica described by the patient, we can be fairly certain we have identified a trigger point for sciatica. We can choose to apply pressure on the trigger point in various ways, using our thumbs or fingers, and we maintain it for about 90 seconds or until we feel the muscle give under our fingers. After reducing the tension of the trigger point we found, we look for others, always in the gluteus medius and minimus group. The important thing is to stay in this area. Now we'll see how to locate the piriformis muscle. We will take reference points into account to accurately locate the piriformis muscle. These are the two dimples that clearly indicate S1 and S2. So from here, we draw the sacrum. Once the two superior posterior iliac spines have been identified, from the junction of the two spines, we locate the second sacral vertebra, which is S2. We know that the piriformis originates from the second, third, and fourth sacral vertebrae. It passes anteriorly through the sciatic foramen, joins, and reaches the upper part of the greater trochanter. If we want to actively locate the piriformis with the patient's muscle contraction, we flex the patient's knee and request that they move their heel inward. Now with this rotation, since the piriformis rotates externally with the hip extended, the piriformis will contract, and in this case, we'll feel the piriformis muscle fibers contracting under our hand. Now that the piriformis is engaged, feeling it well with the patient's muscle contraction, let's locate the trigger points. The most represented trigger points of the piriformis muscle are located at the origin and insertion, meaning in the sacrum and on the greater trochanter. How can we be even more precise? At this point, we have the patient perform another contraction, asking them to push their heel inward yet again, so we can better feel the muscle contraction beneath our hands. At this point, asking the patient for those contractions while we resist their inward heel push, we move our hand in contact with the piriformis along its path, where we feel the tightest part. that is, where we sense the greatest resistance beneath our hand. We get into a more comfortable position and concentrate all our force on that point, even applying double pressure with both thumbs, as you see here. This ischemic compression might cause the classic radiation sign, which can go to the popliteal fossa, or if we always focus on the tense area, that is, the exact trigger point, sometimes we may also observe some borderline fasciculation. It is very important to remember that while we perform this technique, and since the piriformis passes like a bridge over the sciatic nerve, we should be cautious that the patient does not report any significant paresthesia, because at that stage, we could have made the sciatic nerve more sensitive. It is important to note that this last occurrence is quite rare, as in most cases, the patient will experience radiation solely from the treatment of trigger points and nothing else. So, in summary, this treatment consists of the location of the trigger point and applying direct pressure to inhibit it. The patient must be in a comfortable position to ensure the affected muscle is relaxed. We identify and locate the trigger point with flat palpation using our thumb. We apply pressure gradually, steadily, and slowly to the trigger point until we detect the first palpable barrier. We maintain the pressure until we feel a softening of the trigger point. The wait can be seconds or minutes. We repeat the action, increasing pressure on the trigger point until we find a subsequent barrier, and so forth. After maintaining ischemic compression for about 30 seconds, it will feel almost like a slow progressive settling of the muscle, which causes the hand to sink slowly downward. At that point, we release and then increase the pressure on the trigger point until we find a successive barrier, and we repeat until we feel a density that is almost normal under our fingers. At that moment, we move to another trigger point and repeat the same treatment. Thanks for watching our video about sciatica treatment. Remember to subscribe to the channel, like the video, and leave your comments below. Make sure to also watch the video on how to treat piriformis syndrome with trigger point technique and the treatment of lumbago. You can access them by clicking on the side thumbnails. Furthermore, check the link in the description to explore our courses and further your knowledge and skills. See you in our next video.